Some women are rightly a little irritated when they start breastfeeding and realize that, oh, wow, this can really hurt and nobody warned me. So consider this me warning you that breastfeeding, at least in the beginning, can hurt and frankly cause some pain. The good news is it will typically get better. So I'll first start by telling you a little bit about my breastfeeding journey with my son Hudson. The breastfeeding felt totally fine for like the first 2 days, but then the soreness started to set in, and then my nipples became cracked and started bleeding. And every time he would start breastfeeding, it felt like the best way I describe it is like little tiny razors were being pulled over my nipples. And I had been told that this would go away, so to just like grin and bear it and just try to get through it. So I did, and I would just take deep breaths and use all the tools that I'm going to tell you in a minute to soothe the discomfort at least a little bit. And sure enough, after 2 weeks of a lot of discomfort, all of the sudden my nipples toughened up and breastfeeding was totally fine after that. Like I could barely feel it. Like my nipples became totally desensitized. Then 8 years later, I had my daughter Grace. And with Grace, breastfeeding didn't necessarily hurt my breasts, but the breastfeeding triggered the release of oxytocin, which happened with my son as well, but it didn't really bother me because my after labor pains weren't that strong. And these just feel kind of like menstrual cramps for most women. But with Grace, unbeknownst to me, I had a small piece of retained placenta that my body was trying to work out. So for those first 3 days, every time she would breastfeed and that oxytocin was released, it would start like working out that piece of that little placental lobe, and I would experience like really intense pain, like mind-blowing pain. It felt like active labor contractions, but instead of only lasting for about 30-45 seconds, they would last for like 2 minutes. So needless to say, breastfeeding those first 3 days kind of like terrified me because again, my nipples were fine, but the reaction it caused in my body was really intense. And then I probably had like 1 or 2 days after the placenta, that placental lobe released, where my nipples were pretty sore, but then they just toughened up. It's like they remembered how to breastfeed and just got back to that tough spot faster. So again, if you don't have retained placenta and you've already had a baby that you've breastfed, usually with those subsequent babies, breastfeeding can be a bit easier, but obviously not always. We're all different in our experience, right? And so a lot of this soreness, in the nipples themselves, and again, especially with your first baby, often occurs because number one, you've again never been through something like this before and your nipples are like WTF is happening to me. But then baby's latch can also seriously impact the soreness that you are experiencing. And if your baby has tongue tie, it can make it really, really difficult for the baby to properly latch. And so tongue tie is something that both the pediatrician and even a lactation consultant can usually help you diagnose in the baby. All right. Again, luckily, I want you to keep in the back of your mind this pain usually goes away after about 2 weeks, but that can vary, especially if baby's latch doesn't improve. And I won't even get into the situations that arise when the baby gets teeth. I'm going to make a separate video on that one. Other nipple issues that can crop up really any time during breastfeeding, but especially in the beginning, can be a milk blister. And this is essentially like a painful white spot on or around the nipple that is caused by thickened milk or some skin that's overgrown a milk duct and blocked it. An inverted nipple can obviously cause a lot of issues with breastfeeding because it makes it really hard for the baby to latch. And you can test your nipples to see if you have an inverted nipple by pinching the dark area around the nipple, the areola, about an inch behind your nipple. And what the nipple should do is actually poke out and harden, but if the nipple retracts, that would be considered an inverted nipple. Okay, there's also a condition called vasospasm, and this is caused by a constriction of the blood vessels in the breast. And this can cause pain to shoot from the nipple through the breast when breastfeeding. Mastitis. So you might have heard of this one. Mastitis is a breast infection that's caused by a blocked milk duct. And what happens is, as the milk builds up behind this blocked duct, it can cause pain and swelling. It can also cause red streaks to form on the breast, and it can cause flu-like symptoms and a hard lump in the breast. If you experience this, you definitely want to let your care provider know, because sometimes there are different medications that can help clear this up. Thrush. So thrush infection is a contagious yeast infection that can pass from your baby's mouth to your nipple, and it can infect the nipples. So if you notice white or yellowish patches in your baby's mouth or on the baby's lips, or if the baby has cracked skin at the corners of their mouth, go ahead and let the pediatrician know so you can get baby treatment for the thrush. And if your nipples have already been infected, then treatment for yourself as well. And you can also just get a standard blister on the nipples just from the friction caused by, a baby not latching properly, a poor fitting nipple shield, or a breast pump that rubs against your skin. I got blisters on the nipples with both babies, and they were really uncomfortable, but went away pretty quickly, especially by using these following nipple soothing tools. First and foremost, this is one of the biggest ones, see a lactation consultant. So lactation consultants are trained to help you determine if baby is latching properly, they can help you improve the baby's latch. They'll watch you breastfeed and offer really helpful tools for your unique baby and your unique breasts. They can tell you, the best positions to use, if your baby has tongue tie, and they can just provide really helpful emotional support. A lot of women, we don't expect that, especially if we have a tricky time breastfeeding, that we really need a lot of emotional support. So that can be really, really helpful to find a great lactation consultant that you connect with. If you're having a baby in the hospital, in a lot of hospitals, they have a lactation consultant come in and talk with you, support you. Sometimes they're wonderful, sometimes you don't really connect with them. So you can ask for recommendations for lactation consultants outside of the hospital, and you can interview them, find somebody you really like. Midwives are really great at supporting with breastfeeding, but if they feel like, I feel like a lactation consultant could provide, tips that I don't feel qualified to, then they can help you find a lactation consultant. Okay, speaking of that proper latch, again, that latch is so important. So what that should look like is the nipple should be positioned pretty deep in your baby's mouth. And as you breastfeed, your baby's lower lip should be pushed outward over the nipple rather than being tucked in. And if you gently pull down on the corner of the baby's mouth, you should be able to see the side of their tongue cupping the breast. So you should see a little bit of the tongue instead of it fully retracted. That's especially important when they grow teeth, because that tongue blessedly helps to cover at least those bottom teeth. You also want to try different breastfeeding positions, because this can help different areas of the nipples get relief between feeding sessions, help to prevent chafing on the nipples. It's also really important to break baby's suction before you pull them off of the nipples. So you can do this by just sticking your finger in the side of their mouth, and this will break the latch. And to help your sore, maybe cracked nipples heal in between feeding sessions, self-express a little bit of breast milk, meaning essentially just kind of press on your breast so a little bit of milk comes out, dab that milk on the nipples, let it dry, because breast milk has amazing healing properties. You can also apply something like lanolin cream that is safe if baby ingests it. You can also go topless as much as you can. Obviously, it's hard to go topless outside of the house, but when you're home, go topless. This can help to prevent further irritation from like fabric rubbing on the nipples, and it just gives them a little bit more space and time to heal. And when you can't go topless, you can use breast shields. What these are these like dome-shaped, donut-looking plastic things that you place over the nipples and under like a nursing bra, and it keeps your bra, your shirt from rubbing against the nipples and irritating them. So it's essentially like still helping to give the nipples time and space, even if you, again, can't be topless. Back to being topless. When you you can hold like cool gel pads on them, or just put that nursing bra on and stick those cool gel pads inside. Don't use soap on the nipples or anything that is scented, because this can increase irritation and dry out the nipples. I talked about cool, but heat can also help. So applying a heating pad, warm gel pads, or even just a warm wet washcloth on the nipples after feeding can really help, especially if you have something like a clogged duct or mastitis. And take deep breaths as you're putting baby on to latch, especially if your nipples are in a lot of pain, because obviously it is important to keep feeding the baby, to keep your supply up. I know it hurts so bad as you're figuring out the latch, or it can hurt so bad, but just taking those deep breaths can help you not be like really tense as the baby is latching on. Okay, and as much as you can, I know I just said this, but don't stop breastfeeding, as you know, this can reduce your milk supply. And this is if, again, you are determined to continue to breastfeed, because you know, if we trick ourselves into thinking, oh my God, it's always going to hurt this much, I absolutely don't want to do this forever. Again, just remember, it's probably just going to be like either just a couple of days or maybe 2 weeks, and then it'll get better. So just kind of push through as much as you can. And in the case of something like mastitis, continuing to breastfeed can actually be the best way to work through it. You should still let your care provider know, but continuing to breastfeed can help to unclog that blocked duct, and that can provide a lot of relief when it's unclogged. Again, always alert your care provider if you are concerned. And this is probably the 20th time I've said it, but know that it will get better. However, if you treat the soreness, you get past that and it's not painful anymore, but you still feel like breastfeeding just like really isn't for you, there is absolutely no shame in talking to your care provider and the pediatrician about switching to a high quality formula. If you have any questions about this or anything else about pregnancy, childbirth, early motherhood, let me know in the comments below.